Hi, and welcome to week 9 of Nursing 259. This week we will be talking about professional communication, specifically how nurses talk with each other, with their patients, and with other people in the patient's team. So this week, again, for the recording, we'll be talking mostly about the who. Okay, so this is your interdisciplinary team and intradisciplinary team, the scope of practice, roles and responsibilities, the levels of communication and collaboration, and in class we'll talk about the group dynamics and specifically how communication can best be affected. So your readings this week will be in black, and it'll be Chapter 9, Communication and Collaboration in Nursing. There's also a couple of documents in D2L that are loaded that will be helpful for you to understand as well. So let's first start with the concept of teamwork. So when we work with our patients, it isn't just our responsibility to make sure that the patient has the right outcomes. We tend to be focused on what we do in nursing. But really it takes a village. It takes a whole comprehensive group of people, some people seen by the patient, some people not seen by the patient. And all of this, for the patient to have a good outcome, really requires good teamwork and good communication. So let's start with who is on this patient team. And I want to emphasize that this really is the patient's team, not our team, not our institution's team, but it belongs to the patient. And it does, of course, include the nurses and obviously the providers, which would be the medical doctors, the psychiatrists and psychologists. This could be the physician's assistants, the nurse practitioners, technicians and aides such as our nursing assistants, surgical techs, radiology techs, support staff, the people who manage the patient's records that make sure that the patient's information is managed, some specialists. These might include the registered dietitians, the case managers, social workers, pharmacists, if they're having surgery, some anesthesiologists, and the people in administration, right up to the chief medical officer, maybe the chief informatics officer, the chief nursing officer, clinical directors and unit managers, team leads. Educators in places where they have them are also part of that patient team, providing education primarily for the staff, but they can provide education that's focused for the patient as well. And then we also communicate with clinical staff for our patients that are in short-term and long-term care. So who else is on this team? Because a lot of these people on the patient's team go beyond what is happening in our institution, such as our nursing home or our hospital. Again, our patient is really at the middle of all of this, so we don't want to forget about the patient. The community in which the patient lives is also on the team. This could be your public health nurse, this could be public policy, the culture of the community, whether they have access to clean water, whether there's policies in place for clean air, researchers that impact the potential care. For instance, now they're working on this Ebola vaccine that's quite prevalent in the news. Now, and these researchers are helping to create a system with enough checks and balances and protections to protect our general population, of which our patient is part of. Corporations that build the infrastructure and support the healthcare that our patient has access to, and technologists. These can be our IT people that manage our electronic health record systems and other technologists, and institutions of higher learning. I've worked in many communities where we've had medical hospitals, and they're teaching hospitals that provide extra support and extra resources to patients within the community. And a lot of what impacts our patients is really dependent upon the scope of practice. So all the members of the team have expectations and limitations to what they can do and what they should and shouldn't do. So we talk about ethical boundaries a little bit. You probably talk more about this in another class, but I wanted to just make it clear that for some patients, we want to make sure that we're not crossing any boundaries and that maybe our feelings about patient care or our biases should prevent us from taking care of that patient. So these are just things to think about. The Wisconsin State Licensing Board provides the nurses in the state of Wisconsin with a list of what their scope of practice is, and we must maintain that throughout our practice and not cross that boundary. And some of the members of our patients team also have licenses, not all of them. Some are just certified in their field, but they may or may not have licenses, and those licenses from those other providers like speech therapy, occupational therapy, psychiatrists and psychologists and medical doctors have their set of practice rules for how they can practice within our patients' care. And again, this is an interdisciplinary team. The concept of everything kind of folding over each other and supporting each other in a way that none of us alone would be able to accomplish. So taking that village requires coordination, and this can be a very complex system. And communication is an integral part of how that patient's care is received and what the patient's outcomes are. So anytime you have this many people involved in a patient's care, there is a significant risk for breakdown. We're going to talk a lot in class about what those specific risks are and how to mitigate those risks. And then this is a shared responsibility, and recognizing that your own actions or inactions directly affect your patient's quality of care and their safety while they're in your care. And what you don't want to do is grow into an apathetic person that goes, meh, it doesn't really matter what I do, everybody else is screwing up too. You want to be purposeful and complete in your care, making sure that they have the best care that you can give them, because you may be the last protection for them in a series of mistakes that are being made. So it is everybody's responsibility to protect the patient and to make sure that they have the right outcomes. So in class this week, what we're going to be talking about, we've talked about the who, and in class we'll talk about how the information is communicated in healthcare, some of the factors that make communication work or not work, some of the consequences when the communication doesn't work very well or when it's distributed incorrectly. We'll talk a little bit about HIPAA and social media and where our communication can be improved for our patient. Thank you, and we'll see you on Friday.